You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. How are you doing? It's been a while. On today's episode, I will be talking about how to improve your fertility as a woman. Yes, I know that a lot of women are trying to get pregnant, and I always get that question very often: what to do to improve your fertility? Is there anything we can do to boost eggs? Is there anything we can do to get pregnant? Yeah, so I know this topic would definitely go around and affect a lot of women, touch a lot of women. So let's go into the topic proper. Some factor might be beyond our control, truly, when you're trying to get pregnant, and especially when it borders on medical issues. But some other factors can be within our control. They could be they could be our choice, they could be our lifestyle. So because of this, that means that to a very large extent, there are something you can do in that particular regard. Okay, so female fertility is ability to get pregnant naturally within 1 year of unprotected sex, and if you're above 35 years, then 6 months. If you're able to get pregnant within 6 months, yes, that means everything is good. But if not, then you might have to be talking about infertility, and this topic might also be for you then. Okay, so what causes female fertility problems? So let's get to that first before we talk about what to do and how to go about it. Okay, there are various medical issues that can contribute to fertility problem in women. One is ovulation disorder, which can affect the release of eggs from the ovaries. This could also include hormonal disorder such as polycystic ovarian syndrome, hyperprolactemia, thyroid problems. Thyroid problem could be hyperthyroidism, it could be hypothyroidism. Then there could be uterine or cervical abnormalities such as polyps or fibroids in the uterus, which often might cause delay or difficulty in getting pregnant. Okay, another problem, another issue that could also cause infertility could be endometriosis, which occur when tissue grow outside the uterus. There could also be primary ovarian insufficiency that could make one go into early menopause. This usually occur when the ovaries stop working and menstruation ends even before 40 years. There could also be pelvic adhesion. They are bands of scar tissues, which could be as a result of past surgery done, or it could also be as a result of pelvic infection. All these are medical issues that could make women to have infertility problem. Okay, of course, there are also some autoimmune diseases such as lupus. Most importantly as well, age plays a very important role. When you are above 40 years old, the quality and the quantity of your egg would reduce drastically, thereby making it difficult for you to get pregnant. Okay, so all these are issues that could make women to have infertility issues. So let's talk about steps now. Steps to take. One, to improve on your lifestyle, because if you improve on your lifestyle, then there is high chances that you would improve on your fertility need. Lifestyle number one that I will be talking about is to maintain a healthy weight. Try not to be overweight or underweight. Okay, because all this, if you're overweight or underweight, has effects on your ovulation. Okay, you might not ovulate normally. Then secondly is to try and prevent sexually transmitted diseases so that you will not have infection. You need to take adequate care of yourself, rest very well, don't stress yourself, because stress has a way of getting in between getting pregnant, you know. So just try and relax very well, don't overwork yourself, okay? And another lifestyle that I want to talk about is smoking. If you are a smoker, please, you will need to stop this if you are trying to get pregnant. And if you know you roll among friends that smoke, you could also be affected, okay? So you know, smoking has a way of affecting the ovaries, even the quality of the eggs. So please, you might need to stay off hanging around people that smoke, or if you're a smoker, you completely stop smoking during this period. Then heavy drinking is also associated with risk of ovulation disorder, so you might want to watch out on intake of alcohol, okay? Another lifestyle to also watch out for is the intake of caffeine. You might want to watch out on that. You minimize your intake of caffeine. Then I've talked about being overweight, but I also want to talk about over exercise. Yes, I know a lot of people don't know that they could over exercise, so you might want to watch out for that. If you're trying to get pregnant, a minimal exercise is okay, don't overdo it, okay? Don't overdo it to throw your body to overstress your body, okay? Then, so I will also talk about environmental pollutants that could also affect pregnancy or affect you from getting pregnancy. If you're trying to get pregnant, you might please try and stay away from toxins such as pesticide, dry cleaning solvents, and even fumigation. Some fumigation chemicals are very, very toxic, you know. So please, you might want to stay away from all that if you're trying to get pregnant. We do say this a lot of times to our intending mother that are doing IVF with us. Immediately after embryo transfer, we tell them to stay away from all this bad smell, because truly they have a way of affecting the embryos. So just the same thing applies to you. Even if you're not doing IVF, you're trying to get pregnant, try and stay away from all this environmental pollution, and you know, and it helps in helping you to get pregnant. I hope today's topic is impactful, and I hope you enjoy today's topic. If you want to book a consultation with us, please feel free to call the number showing on your screen, and you can also send us a DM. Don't forget to follow us on Instagram at Meet Surrogate Mother, and to book a consultation, you can as well call the number showing on your screen. Thank you, and God bless.